A health alert nationwide. Nearly 3 million people already have been confirmed with cases of the flu. According to the latest numbers from the Tennessee Department of Health, we are experiencing minimal levels of flu right now. But with the holiday travel season looming, health experts are warning the public to be extra careful. Dr. Nick Highsmith, the medical director of infection prevention at Le Bonheur Children's Hospital, joins us now to talk more about the new variant going around this season. Doctor, welcome back to 3 at 3. Good to see you as always.
Thanks for having me.
Let's talk about this mutated strain of the virus. How concerned should we be about it?
Yeah, I think we should be very concerned. It's become, that time of the year where we start to look at influenza, we start to prepare ourselves and be a little bit anxious about what the flu season is going to bring. We know, looking from our partners around the world and in the southern hemisphere, that it's probably going to be a rough season. We're seeing this new strain that's cropping up. It's called the K. It's from the K clade. Not to get too technical, but we are worried that we're going to have a pretty rough flu season.
Yeah, we've seen cases really sweeping the UK. What about here in the U.S.?
We've started to see it trend up. So normally it starts mid-December, which is right where we are. So it's starting right on time. We've seen over the last several weeks the cases in the Mid-South creep up. This is mainly looking at our pediatric population because I'm at Le Bonheur. But we can see across our partners in the area the number of cases that they're seeing in the clinics and the number of cases that we're seeing in our emergency departments. And those have steadily trended up over the last week or so.
So, Doctor, any certain age group right now? I know what you're seeing at Le Bonheur because, of course, it's a children's hospital, but are we seeing an older group, younger group? What are we talking about?
We're seeing mostly a slightly older group, school-age kids, age 5 to 18 is what we're seeing, and then in our elderly population as well. And those, the elderly population and the small kids are the ones we worry about the most.
You mentioned the possibility that this could be maybe a more severe flu season. Why so?
This new variant. So we know that our flu vaccine is very effective this year, but the strains for the flu vaccine are picked the previous year, right? So we didn't anticipate a new variant being here this year. The flu vaccine still protects against it. However, we wish it protected a little better. But you should still get your flu vaccine. So don't think I'm saying don't get it. It will protect you and it will still prevent serious illness, but it's just not quite as awesome as the ones we've had in the past.
And Dr. Highsmith, as I listen closely to you here, what about colds? What about other respiratory illnesses as well?
Right.
How does all of this play together? Right.
It's always a struggle in the winter because we're wrestling with COVID, we're wrestling with RSV, we're wrestling with flu, and how do parents tell those apart? How do we tell them apart? And I think that, with influenza, you're going to feel really great 1 minute, and then 10 minutes later, you're going to have a really high fever. Really high fever, usually. That's the hallmark of influenza. And then you're going to slowly start to just be run down, body aches, muscle aches, that sort of thing. We don't see, luckily, as many respiratory symptoms with influenza. With colds, a lot of respiratory stuff, upper respiratory congestion, a lot of sneezing, coughing, respiratory symptoms, trouble breathing, that sort of thing.
Talk to us, though, about, especially as we go into the holiday season over the next 2 weeks in particular, why should we be proactive?
We don't want to get other folks around us sick. I think that's the biggest thing. Protecting yourself and protecting those around you. So I would say at this point, if you haven't gotten your flu vaccine, there's still time to do it. Please go out and get it. If you think you're going to be around someone who may have a lower immune system or may have chronic medical issues and you start to feel bad, maybe postpone seeing that individual for just a little bit of time. I know that's really hard when all the family's coming around, but just be a little bit extra careful if you're not feeling well around those individuals.
One last thing very quickly. Hate to bring it up, COVID-19. Should we still be concerned about that as well?
Right now, our numbers of COVID are down, so that's great. We've seen some in the last several months. We saw a little peak about a month or so ago. I think that right now we need to focus on influenza and RSV and seeing what those are going to do over the next month or so.
And Dr. Nick Highsmith, always good to have you back here.
Good to be here.
Enjoy your holidays.
Thank you.
All right.